grammarian. I'm sorry, grammarian. Up to offer the word of the day. My apologies.
Yes. The word of today is recant. For those who are American, I hope I pronounced that correctly. It means to formally reject or disavow or formally held belief. The synonym is to retract. So recant.
Recant. Thank you. So we always try to incorporate that. We encourage our next prepared speaker to somehow maybe fit that in, but particularly for when we do our table topics or our improvised speaking. Recant. Try to work that in. I'm sure you'll find a way. So I do want to ask our timer. Who's our timer? Thank you. To put a 1 minute on so people can put their feedback.
Yeah.
Yes.
You can just scan with your mobile phone the QR code.
Yes. So on the QR code that's on your agenda.
Feedback or.
And you can send it to for Yan.
Yeah.
Yes.
Her name is there. You can just there's a few options. Just select the evaluate option. Evaluate in the front.
I'm going to just give you a minute to do that.
Are we having other speakers?
Yes, we're having one other speaker. Thank you. We have usually most meetings have up to 2, 3 speakers. It's pretty typical across different Toastmasters meetings.
Just speaker one. Yes, choose the speaker one. That's the next one.
Yes, sorry. Should do that on the screen. Next time, I'll demonstrate it on our screen for you to see.
You go to the evaluate.
This is I said
Time.
Yeah,
we're at 1 minute mark.
Thank you.
Okay.
So at this point, I would like to invite our second speaker, who is Joanna, and she's also part of the Pathways program, and her particular focus is on presentation mastery. And her title of her speech is Connect with Your Audience. Connect with your audience. Joanna, please join me at the stage. Thank you.
Cat is a really tough word of the day. I had to look it up again.
I'm sorry, it's the New York Times. Yeah.
I'll recount a few details of my introduction. So I'm in my persuasive speaking pathway, and this is a level 3 that I'm on, and it's one of the elective speeches for level 3, and the topic or the objective is to engage with my audience. Not necessarily participatory engagement, but more connecting to you in terms of your context, who you are, your demographics. I'm going to introduce you to a WHO. Does everyone know what WHO stands for? World Health Organization. WHO psychological self-help intervention called Step by Step, and that's the title of my speech. It's a self-help intervention for adults with moderate to severe depression, especially in humanitarian settings, and LMIC. LMIC. So in the UN we have acronymitis. I'm making that up. What does it stand for? LMIC. I'll give you a hint. The first letter is low.
Moderate income countries or
Very good. Yeah, low and middle income countries. Yes. So this self-help tool is particularly for people in low and middle income countries. And see, it's hard to say. That's why you can use the acronym. And humanitarian settings. Depression is the leading cause, one of the leading disability causes in the world. And it's a major driver of economic loss. Why? When you're not feeling good, when you're not feeling motivated, when you're feeling down, you are far less likely to go up and do things, go to work, etc. Globally, most people with depression never challenges. Think about when you have to do a doctor's appointment for anything. For me, it's just, oh my God, just to make the appointment, to find the timing that works, to think about the cost and the copay and the insurance, and that's in a developed country. The gap for treatment of depression in LMICs exceeds 75 to 80%. And that, of course, is even higher in humanitarian settings. So, what do we do about that? There's not a lack of knowledge about how we treat depression. There's a lot of evidence base and procedures and interventions how to treat depression. The question is, how do we reach the people in need? So, all right. WHO guidelines recommend psychological interventions, especially delivered by supervised and even trained non-specialists, for mental health conditions. Exclusive research of this shows their benefits, including in humanitarian settings, yet access to the interventions are limited. And that's where the step-by-step program comes in. Step-by-step is a brief guided digital psychological self-intervention that helps people learn practical skills to manage their depression, or anxiety, or stress. It's designed for conflict-affected populations, for refugees, for displaced people, and low-resource communities. It's not suitable for people with severe cognitive impairment or pending suicide risks, but it does have referral pathways built in to address those clientele. The program consists of 5 weekly modules, approximately 30 minutes each, and it's very visual. I have to show you. These are 5 modules. Progressive tools and pathways to give you skills and resources. So you have a little toolbox, and in your toolbox you can assess your mood, you can identify something that fits at the time and access it. And it has exercises built in, like a breathing exercise, which I might add, it's very useful when you're giving a speech at Toastmasters. Breathe. Also written into the program, and this is one of the things that makes it so good, it's very adaptable to different contexts. So the program has written in a trusted guide. Meet Dr. Maha. This can be adapted to different contexts. So in Lebanon, where it has been nationally provided, this program, it's adopted. But in other contexts, that could be a community healer or a religious leader. And it includes also peers, and they share their story. So the storyline follows what is specific issues in those contexts, like humanitarian contexts. And the peers walk the person through saying, I've gone through this. This is how it's helped me. And it's supposed to motivate and help the person go through. It's extremely evidence-based. There have been several RCT, randomized controlled trials, that have proven its effectiveness. It's not perfect. It still has issues of retention and keeping people engaged, but the evidence shows that it does have significant effects in reducing depression. In simple terms, the intervention helps people help themselves. Improving mental health globally doesn't always mean something complex. Sometimes it just starts with one small step at a time. Thank you.
Thank you. Superb. Thank you so much. I have a dear friend that just recently got diagnosed with Parkinson's. resistance.
Good.
And something like this, she has something similar, and it helps. These tools help so much because it has you understand the reality that you're dealing with by talking to peers, by having some of these questions and surveys, self-questions. It helps her so much, and then of course the engagement with her doctors and experts in the field. But thank you so much, Joanna, for illustrating how WHO is doing using these similar tools. I'm going to ask our timer, William, for a minute on the clock. And again, please use the same QR code that's on our agenda to give Joanna your feedback.
You can just scan with your phone this QR code and choose the third option, evaluate. Yep, time is up.
Thank you, William. So table topics. This is one section of a Toastmasters meeting that never gets retracted. So I'm going to welcome our our table topics master, Peter, to come to the stage and refine our improv speaking skills. So thank you, Peter.
Thank you, Alex. Thank you, Alex. Thank you, Madam Toastmaster. Table topics, for those of you who are new to us, these are 1 to 2 minute speeches. You don't have any time to prepare. This is good training for what happens in life because somebody asks you a question or they expect you to respond to a comment that is made. So practice from real life situations. Tonight, we'll talk, we have limited time, we'll squeeze in as much as we can to this. Tonight, let's talk about metaphors. What is a metaphor? If you really want to make a point in your speaking, but you want to do it with subtlety, you use a metaphor. What is a metaphor? It is a comparison of something normal to something absurd. The most famous, I think, metaphor in the English language comes from Shakespeare, who said, life's but